Hey everybody, this is Kevin with Nursing KAMP.com, and this is my Mastering Nursing School and NCLEX tips for nursing school and what you need to know about nursing school and how to study more effectively and to prepare for the NCLEX. And this is the 5th video in my series of 7 videos of 7 NCLEX tips that you need to know. In this one, we're going to talk about ALEAPS, what you need to know about procedures and how do you study procedures. So let's get into it. Previously, I talked about in a previous lecture was the 4 squares method. It's a method that we use while we're in lectures and how we isolate content that we need to study further. We then went into how you isolate the contents with pluses and minuses. Please see those lectures where I cover that more clearly. Then we talked about the burn list, which the burn list is a method that you take this content and you add it to a book. And that book is your burn list. And that burn list is a list that you will compare with other people, as well as it guides your understanding of the content. But how do you know whether or not you know the content at a level that's a good understanding? And that, especially when you're comparing or studying with other people, you really want to evaluate, do we all know the same things here? Because you're tested on the most likely what everybody in the classroom knows, not the nuts to know stuff. So you have to isolate, am I in the rabbit hole or am I not? And how do I do that? Well, there's 3 different methods that we do, and that's called, ALEAPS. And we use this method for whenever there's a condition. So if we're looking at something like we said a PE, a pulmonary embolism, we have to define that because it's a condition, right? And so what we do is that we go through this method where we say, do I know whether it's acute or chronic, how it starts, labs associated, is eating affected by it, assessment before, during, after, any prescriptions related to it, any problems, and what's the 3 things that would cause me to run down the room with the patients with a PE or call a doctor in the middle of the night because the patient has a PE. Another way that we use this is when we're meeting together in study sessions. If somebody's not really clear on the content, they'll struggle with this ALEAPS. And that will be a defining factor that you need to study that content, because you don't know it clear enough to be able to articulate and teach it. So a lot of times this ALEAPS method and the next one, AWALES, are all things that we would teach a patient about and most likely be tested on. And that brings our next thing, which was AWALES. Now, AWALES is another method that we look at when we look at medications, and it goes back to that 4 squares, where those 4 squares, whenever you have a medication that's set in class, you want to start to compile in your brain book in a section of meds, and you want to build this meds by unit in relationship to the concept. When you look at something like Coumadin, it should be related to AFib or recurrent PEs or something like that. Most likely AFib though. And when you talk about Coumadin, what's most likely is bleeding and teaching a patient about it and monitoring their lab values, where we said the PT, INR, and so on. Now we're going to talk about the last thing. And the last thing to evaluate is of the 4 squares. And we said that down here is diets, isolation precautions, procedures, and labs. Well, there's only certain labs that we need to know, and we'll talk more about that when we get to labs, but the main thing is procedures. So if you're looking at a procedure, that's called ALEAPS. Now, ALEAPS is a method just like AWALES is, and ALEAPS, right? It's just a thing. It's a mnemonic that will help you understand what you need to know and what you don't need to know. So let's take one, so we'll kind of walk through it, and let's take a spinal tap. Is a spinal tap acute or chronic? Well, could you call up the doctor at 3 o'clock to get a spinal tap? Yeah, you could if the patient has meningitis and you're not sure, everything like that. So it's an acute procedure. It's very invasive. What's it looking for? Like meningitis, like I just said. Any labs associated with it? Well, you wouldn't send a patient down for a spinal tap if they have platelet levels less than like 75,000. Follow policy, but that's a thing. If a patient is on, Coumadin, I don't think I'd be putting a needle in the back, and so on. Anything with eating, can they eat before it? No, I don't think so. I don't think it's a big deal. You know, I mean, it's a spinal tap. It's invasive, but has nothing to do with diet. What's some post things with that? Well, maybe, you don't bear down and different things like that. So maybe constipation might be an issue, but not most likely. Assessment before. Evaluate labs. I just talked about that, right? Can that patient sit still? What about during? Not most likely. Whenever you talk about procedures, NCLEX will never test you on during the procedure. It's usually a patient is going down and coming back. That's the most likely that you're tested on in the NCLEX. It's never about during. It's usually because most likely you're going to have a patient that, is preparing to go, and then you need to evaluate. Or the patient just returned, and that's another thing that you're tested on. So usually not during with procedures. Prescriptions. Any prescriptions related to it? Yeah, I just said, like Coumadins, anticoagulants. You probably hold those before you stick a needle in the back, right? I mean, you want them to clot. Any problems post? Yeah, meningitis. Became infected. Those type of things. So they're going to sit still, and and you're not going to get them up and moving. There's going to be bed rest, there's some occlusive dressings, and there's all these other factors of assessment about it. What's the standout three of this? Well, I mean, nuchal rigidity. Do they have, pain in the neck after a spinal tap, or do they have a leaky dressing? Those type of things, and that's when we try to stand out. So leaps are for procedures, right? So, leaps, right? So looking for something, and so if you're looking at an echo, it's looking for the heart, and it's looking at heart failure. Well, those are the three things that you're most likely to isolate on your 4 squares in order to see what you know, what you don't know, and then to bounce it off with each other in a group, in which that's going to talk about the next portion when I talk about NCLEX questions and study questions for the NCLEX and for class, and what you do during it. What you don't do during it is this: running through apps, wasting your time. And this is not about wasting time. It's about being purposeful in your studying, and purposeful in your class, and making your time most efficient in the way that you're studying, and to be successful in school and to be successful in your NCLEX. My name is Kevin. This is Nursing Camp, and these are my tutor tips on NCLEX class and how to study more effectively. In the next video, I'm going to talk about NCLEX questions, and we're going to wrap it all up, and then we're going to finish up with conceptual camp.